All right, so I'm going to start with chapter 7. Chapter 7 is a quick overview of bones, and the first PowerPoint deals with the axial skeleton. The second PowerPoint deals with the appendicular skeleton. What you need to know is what's in the PowerPoints. So that is the material that you're responsible for in the test, is the material in the PowerPoints. So the first thing we need to know is which bones are axial and which bones are appendicular. Know the function of bones, which is part of chapter 6 also, and know the components of the skeletal system, which were also discussed in chapter 6. So you should know which bones are axial bones. So in the test, given a bone, you should be able to classify it as axial or appendicular. Axial bones are the bones found in the skull, in the rib cage, and the vertebral column. So, for example, the hyoid bone under the mandible will be an axial bone. The ossicles in the inner ear will be axial bones. So those will be bones that you may not think of them as being axial, but they are. All of the vertebrae are axial bones, as is the sacrum and the coccyx. Obviously the ribs, the sternum, etc. The appendicular bones consist of the bones of the upper limb and the lower limbs, and then what we call the girdles. The girdles are going to be the bones that attach the upper limbs to the axial skeleton, and those will be the clavicle and the scapula, and the bones that attach the lower limbs to the axial skeleton, which will be the pelvic bones. So that will be the ilium, ischium, and pubis bone. So these bones may seem to be part of the axial skeleton, but they are not. So be careful with these girdle bones. So again, just review the function of bones from chapter 6. Component of bones again for chapter 6 we went over these. Okay. Again, know the bones of the axial skeleton, the appendicular skeleton. Given a bone, let's say the phalanges of the hand, that will be appendicular skeleton. Ethmoid bone will be axial skeleton. Then from the axial skeleton, the material that you need to know are the bones of the cranium and the face. What is the cranial fossa, which is the cavity where the brain is located. Know the sutures. Know the bones that make up the orbit of the eye, which bones have sinuses, the bones that make up the nasal cavity, the bones that make up the hard palate, what is cleft palate, and the following features of bone: the sella turcica, occipital condyles, foramen magnum, and the temporomandibular joint. And most of these information you would have discussed it already in lab or studied it in lab. So the axial skeleton again consists of all the bones of the face, vertebral column, and thoracic cage. That also includes the ossicles in the inner ear, the little bones of the ear, and the hyoid under the mandible. So you should know the bones of the cranium, and those will be the frontal bone, the two parietal bones, temporal bone, and occipital bones. The bones of the face will be the maxilla, the mandible, the zygomatic bone, the nasal bone, the lacrimal bone, ethmoid, sphenoid, vomer, and palatine bones. The cranial fossa is the cavity where the brain is located. So this is what we call a superior view of the skull with the cranium removed. So you cannot see the parietal bones or the occipital bone because that top part of the cranium has been removed. So what you see here is the cavity now. And the front part of the cavity is made by the frontal bone. And you can see etched in the middle of the frontal bone this little triangular piece of the ethmoid. The ethmoid bone. On either side, we have the temporal bones. So we're going to have a right temporal and a left temporal, and then the occipital bone back here. Oh, and forgot the sphenoid. This right here, including these, will be the sphenoid. So those are the bones that can be seen from a superior view of the skull as we're looking into the cranial fossa. Cranial bones come together and form joints called sutures. The sutures that you need to know, let's see. Okay, that's just again identifying bones. I'll come back to this in just a second. Let's go over the sutures. All right, come on. Okay, there we go. All right, so up here in the front, between the parietal bone and the frontal bone is the coronal suture, which is going in the coronal direction. Between parietal and occipital is the squamous suture. Between parietal, is the lambdoid suture. Lambdoid suture right here. Between parietal and temporal is the squamous suture. So notice that the parietal bone is involved in each one of these sutures that you need to know. The only suture that we cannot see from this view is the sagittal suture, which is between the two parietal bones. So right here, this is the sagittal suture. Okay. Here is the lambdoid suture, and you can see a little bit of the squamous suture right there. Okay, again, this will be the coronal suture between pulse and frontal, and the lambdoid suture between occipital and parietal. And here is the sagittal suture. So you should, given a description of the suture, you should be able to identify it. So for example, which is the suture that is made by the frontal bone and the parietal bones? That will be the coronal suture. Which suture is made by the parietal bones and the occipital bone? That will be the lambdoid suture. This is a side view of the skull. You can see the frontal bone, parietal bone, occipital bone. This is temporal. This little piece of bone right here is going to be the sphenoid. This will be the zygomatic bone, maxilla, mandible. You can see a little bit of the lacrimal right there, a little bit more of the sphenoid. From a posterior view, you see the occipital bone with the lambdoid suture, the two parietal bones with the sagittal suture right there. You can also see parts of the mandible. So the occipital bone makes the back part of the skull, the posterior wall of the skull, and it is the site of attachment of muscles of the neck. Again, here you see the squamous suture right there, coronal suture over here. The maxilla up here is the upper jaw bone. The mandible is the lower jaw bone. So something else that you will be asked to do in the test is to match the common name of the bone with its anatomical name. So for example, zygomatic bone is the cheekbone. Again, the mandible is the lower jaw. Maxilla is the upper jaw. Nasal bone is the bone of the nose. Notice that both the maxilla and the mandible have teeth. Notice also that the maxilla makes up part of the orbit of the eye. Again, a frontal view of the skull. You see the frontal bone up here. You see a little bit of the sphenoid right here. The temporal bone is this yellow one that you can see peeking from either side. These blue-greenish bones are going to be the zygomatic or cheekbones. There's your nasal bones up here. The purple one is the maxilla or upper jaw. We're going to go over the bones that make up the orbit of the eye here in just a second. mandible, you can see it down here. We're also going to go over the bones that make the nasal, that we will find in the nasal cavity. So let's start with the bones that make up the orbit of the eye. And this is something that you have to know for the test, okay? So at the roof of the orbit of the eye is made by the frontal bone. The lateral wall, right here, is made by the zygomatic wall, zygomatic bone, right there. Okay. The floor of the eye socket right here is made by the maxilla. The medial wall is made by two bones. The little one here is the lacrimal. The one back here is the ethmoid. So lacrimal makes the medial wall. Ethmoid made the medial wall. And then there is a tiny little piece of the palatine bone that appears in the eye socket, but it's very, very tiny, and oftentimes we ignore it. Now the back wall over here is made by the sphenoid bone. So again, a sphenoid is on the back wall. The zygomatic is the lateral wall. The floor is the maxilla. The lacrimal and the ethmoid behind it will be the medial wall. The roof is the frontal bone. Same thing one more time, but this time they're showing you the location of the palatine bone. That little bone picking there, that little piece is the palatine bone. So if you forget about it, don't worry. It's most drawings ignore it. Okay, but you definitely have to know the bones that make up the orbit of the eye. The other bones that you need to know are the ones that make up the nasal cavity, and those are a little bit more difficult to picture. So right here, we're going to have the ethmoid bone right here. This is part of the ethmoid bone right there. This green one is the nasal bone. And let me actually show you this picture right here. It's a little bit better. So this is the vomer right here. This is the perpendicular plate of the ethmoid. So the two bones that make the walls of the nasal cavity are the ethmoid, the perpendicular plate of the ethmoid, and the vomer. Okay. Notice that you can also see from here the two bones that make the roof of the mouth, the hard palate. Those two bones will be the mandible and the palatine bone down here. So the palatine process of the mandible and the palatine bone make up the hard palate. So here's a frontal view of the nasal cavity. You can see this orange bone right here will be the perpendicular plate of the ethmoid, and the blue one underneath is the vomer bone, making up the nasal septum that separates the right and left nasal cavities. Some of the skull bones have cavities inside called sinuses. The function of the sinuses is to lighten the skull and to provide an area for resonance. For sound production. The bones that have sinuses are going to be the frontal bone, maxillary bone, ethmoid, and sphenoid. So if you look at this picture right here, these two sinuses on either side of the nose are going to be the maxillary sinuses. The two sinuses here at the head are going to be the frontal sinuses. And then we have the ethmoidal sinuses in green, the sphenoidal sinuses in yellow. So you should know the bones that make up, that have sinuses. Another important feature of the bones of the skull is the bone that houses the pituitary gland. The bone is the sphenoid. The feature of the bone where the pituitary gland sits is called the sella turcica. Another important feature is the foramen magnum, which is the huge opening where the brain attaches to the spinal cord, and the spinal cord travels through the foramen magnum. So this huge opening is the foramen magnum. You have the sphenoid bone right here. You have the ethmoid right there, temporals, occipital, and frontal. Now, the way the skull sits on top of the vertebral column is that the occipital condyles are going to sit on top of the facets of the very first vertebra. The very first vertebra being the atlas. So here's a good depiction of the atlas right there. So the skull is balanced on top of the atlas. Below the atlas there will be the axis, which is the second cervical vertebra. Again, the hard palate is made by the perpendicular plate of the maxilla. Let me get that one. Let me repeat that one. The hard palate is made by the palatine process of the maxilla here at the front, and behind it, the palatine bone. So there are two of the maxillas coming together right in the middle of the mouth, and two palatine bones coming together to make up the roof of the mouth. So you can feel a ridge in the middle of your hard palate, which is the place where these two bones come together. There is an abnormal condition in which these bones do not seal, do not come together, and therefore they will leave an opening connecting the oral cavity with the nasal cavity. The condition is called a cleft palate. It's a congenital anomaly, and nowadays it is fixed, repaired through surgery. So you should know what a cleft palate is. The problem with the cleft palate, aside from the obvious cosmetic issue, is that babies need a closed chamber to be able to suckle. So these babies with a cleft palate cannot suckle and they cannot eat. The mandible is the lower jaw, is the strongest bone in the body. It articulates with the temporal bone to make up the temporomandibular joint, which is the only freely movable joint in the skull. It's also called the TMJ for temporomandibular joint. And the temporomandibular joint is made by the mandibular condyles of the mandible, articulating with the mandibular fossa of the temporal bone. Okay, so that takes care of the cranium, the skull. And we're going to look at the vertebral column now, and you need to know the functions of the vertebra, the regions and numbers of vertebra in each region, the vertebral curvatures, and which are primary curvatures, which are secondary curvatures. Know the abnormal curvatures of the spine, the structure of intervertebral discs, what is a herniated disc, what is the spina bifida, what is the importance of atlas and axis, and the vertebral prominence. So the vertebral column's function is to transmit the weight from the trunk to the lower limbs, supports the head, the trunk, protects the spinal cord, the spinal nerves, provides site for muscles attachment, and allows for the movement of the head and the trunk. The vertebral column is a flexible structure. It is made of 26 vertebrae, and then 5 fused vertebrae that make the sacrum, 4 to 5 fused vertebrae that make the coccyx. There are 4 curvatures and 5 regions. So the regions of the vertebral column consist of the cervical region, thoracic region, lumbar region, sacral region, and coccygeal region. The cervical region has 7 vertebrae, thoracic region has 12 vertebrae, lumbar region has 5 vertebrae, sacral has 1, and coccygeal bone is, coccyx is just 1 bone. The sacral bone is actually about 5 vertebrae fused together. So you should know the regions of the vertebral column. A good way to remember is to say that we eat breakfast at 7, lunch at 12, dinner at 5. And that gives you the number of vertebrae in the cervical, thoracic, and lumbar regions. Okay. So the sacrum is the bone inferior to the lumbar region. So the vertebrae are named C1 through C7, T1 through T12, L1 through L5. The sacrum is below L5 vertebra, and the coccyx is below the sacrum. Curvatures. The spine has 2 curvatures. It has 2 primary curvatures and 2 secondary curvatures, or 2 concave curvatures, which are the cervical and lumbar, and 2 posterior convex curvatures, which are the thoracic and the sacral. So when it comes to primary curvatures, the primary curvatures are the ones that we're born with. So we're going to be born with a thoracic curvature and a sacral curvature. So if you look at the spinal cord, these will be the thoracic curvature. These will be the sacral curvature. So we're born with the thoracic curvature and the sacral curvature. And oops, sorry, not that one. Sacral curvature over here. Let me go ahead and erase. Okay, so we have thoracic curvature right here and sacral curvature right here. Those are the two curvatures that we're born with, and therefore they're called primary curvatures. And that will be thoracic. And down here, sacral curvature. The secondary curvatures or acquired curvatures are the ones that we acquire when we begin to lift our heads, and then we're going to acquire the cervical curvature right here. And when we begin to walk, we're going to acquire this lumbar curvature right here. So this will be lumbar, and this will be cervical. So you should know the normal curvatures of the spine. Cervical, which is a secondary curvature, we acquire when we learn to hold our heads. Thoracic curvature, which is a primary curvature, we're born with it. Lumbar curvature appears when we learn to walk. Sacral curvature is a primary curvature, it's always there. So think of a baby's back and look at how round it is. That's because it has a thoracic curvature and a sacral curvature. Now, abnormal curvatures of the spine. Kyphosis is an abnormal thoracic curvature. Lordosis is an abnormal lumbar curvature. Scoliosis is an abnormal S-shaped side-to-side curvature. So you should know the curvatures of the spine. The intervertebral discs are pads of cartilage, of fibrocartilage, found between vertebrae. It is made of two components, the nucleus pulposus and the annulus fibrosus. The annulus fibrosus is the outer collagen connective tissue fibrocartilage layer. Inside the annulus fibrosus is a gelatinous layer, which is going to absorb shock and give elasticity to the intervertebral discs. So here is the nucleus pulposus and the annulus fibrosus. Give you another picture of it. Again, this is the nucleus pulposus, and what's surrounding it is the annulus fibrosus. So you should know the two features of the intervertebral discs. Now, a herniated disc, or better yet say a misplaced disc, a slipped disc, sorry, I couldn't think of the word. A slipped disc is one in which the annulus fibrosus has slipped out of position. So the annulus fibrosus, the annulus fibrosus is out of position, presses on nerves, and causes pain. A herniated disc is a little bit more serious because now the nucleus pulposus is spilling out of position over the annulus fibrosus. So you should know what makes a herniated disc. Spina bifida is an abnormal condition of the lamina of the vertebra that doesn't close, and then there are exposed nerves through the vertebra. And it has different levels of severity depending on what's being damaged. So important cervical vertebrae are going to be C1, which is the atlas, C2, which is the axis. Remember, the atlas articulates with the occipital condyles, while the axis is going to, the process of the axis is going to be positioned in the atlas, allowing us to rotate axis against atlas. The vertebral prominence, let me go back to that. The vertebral prominence here, that is C7, which is the last of the cervical vertebra And if you feel the bottom of the base of your neck, you're going to feel this spinous process that kind of sticks out more than the others. That is the vertebral prominence. So it is a landmark because you can feel it through the skin, and it represents the base of the neck. So this is a representation of the way C1 and C2 fit together. These vertebra underneath is C2 or axis. C1 is positioned on top of it, so it's going to rotate and allow us to say no. There's the atlas or C1 vertebra. The sacrum is made by about 5 fused vertebrae, and it articulates superior and laterally with the hip bones. The coccyx is the tailbone. It is also made of 3 to 5 fused vertebrae. It articulates with the sacrum superiorly. So this is the sacrum, and this smaller bone here is the coccyx. Notice this articular surface, which is going to allow for the pelvic bones to attach to the sacrum via the articular surface. Okay, so finally we're going to look at the ribs. We have 12 pairs of ribs, which means we have 12 on the side, on the right, 12 on the left. And what we're going to do is we're going to classify them based on the relationship with the breastbone, which is the sternum. Okay, so we have 12 ribs, and the first 7 ribs, 1, 2, 3, 4, 5, 6, 7, are called true ribs, 1 through 7, because they have a direct attachment to the sternum. The next 3 ribs, which will be 8, 9, and 12, so it will be 8, 9, oops, I have this label. Okay, so it would be 12, 9, 8, better go backwards, so 8, 9, and 12 are going to join to the sternum via the cartilage of number 7. Okay, so it's an indirect connection. They're called false ribs. And then we have 2 ribs that are not attached to the sternum at all, and those are called floating ribs, and those are 11 and 12. So again, we're going to have 7 true ribs, 3 false ribs, and 2 floating ribs. The sternum is made by the manubrium, which is the top part. So this is the sternum right here. The manubrium is this top part right here. The body is below. And this is the xiphoid process. Okay, so you should know the parts of the breastbone or sternum. And you should also know the different types of ribs. Now, let me go back to the ribs again, and remember that I want to introduce another term for these ribs. Remember that 1 through 7 are attached directly to the sternum. So these 7 ribs right here with a direct attachment to the sternum are called vertebral for vertebra, sternal ribs. Okay, so vertebral for vertebra, sternal for sternum. The next 3 ribs are going to be attached indirectly to the cartilage of number 7. So there's an indirect attachment to the sternum. These are going to be called vertebral. Put it in here. So 1 through 7 are vertebrosternal. 8, 9, and 10 are vertebrochondral. 11 and 12 are floating ribs because they're not attached to the sternum. So these two right here are also called false ribs. Okay, so you should know the first 7 are as vestibulosternal or true ribs, 8, 9, and 10 as vestibulochondral or false ribs, 11 and 12 floating ribs or also called false ribs. Okay, so that takes care of the first set of PowerPoints. I'm going to go ahead and go to the second set of PowerPoints right here, which are actually even shorter than the first set. This second set of PowerPoint deals with the appendicular skeleton. And again, review the components of the appendicular skeleton. The pectoral girdle has the scapula and the clavicle. The pelvic girdle has all the pelvic bones. Then we have the upper limbs with the arm bone, the forearm bones, the wrist, the hand bones, and then the lower limbs with the thigh, leg, and foot. So we can start with the pectoral girdle, which is made of the clavicle. The clavicle is also called the collarbone. And yeah, there will be questions in the test that are going to ask you to match the common name of the bone with the actual anatomical name of the bone. So the clavicle is called the collarbone, and the scapula is are called the shoulder blades. Okay. All right, and here you can see the attachment of the clavicle and the scapula with the ribs. Okay, the scapulas are also called shoulder blades, and the scapula is going to join with the humerus laterally, right there, and with the clavicle on top. This is the back view of the clavicle, of the the scapula. Okay, upper limbs. The common name for the humerus is the arm bone. Then coming from the humerus are 2 forearm bones, which are called the radius and the ulna. We have 8 carpal bones or wrist bones, 4 proximal, 4 distal, 5 metacarpal bones in the palm of the hand, and then 14 phalanges, which are the hand bones and the fingers. So humerus is the arm bone, and you should be able to label the name, the common name of the bone plus the anatomical name. So the common name will be arm bone, the anatomical name is humerus. Tibia and ulna are the forearm bones. The ulna is medial, the radius is lateral. And this is something you have to remember. So here's the ulna, and that's going to be medial, and this is lateral, is going to be radial. When it comes to the bones of the hand, this is what we're going to have. We're going to have 4 carpal bones, which are going to be proximal, 4 carpal bones that are going to be distal. And their names, which you would need to know, will be the scaphoid, the lunate, the trapezium, the trapezoid. And then we come back here to the 4 distal bones. And we're going to have the hamate, the capitate, the pisiform, and the trochlear. The pisiform on top and the triquetral at the bottom of the pisiform. Okay. When it comes to pelvic bones, there are 3 bones that make up the os cocci, the ilium, ischium, and pubis. Pubic bone is inferior and frontal. Ilium is superior bone of the skull. The ischium is going to be inferior and posterior. Okay. One of the things you need to be able to identify are the distinguishing features between a female pelvis and a male pelvis. And one of the first things that one notices is that these two pubic bones that come together at the pubic symphysis are going to be more spread out in a female, not as much as spread out in a male. So it will be at larger than 90-degree angle in a female, less than 90-degree angles in a male. Notice that the pelvic brim is more round in the female, not as round in the male, which is going to allow in the female for a bigger pelvic cavity here versus the male, a smaller pelvic cavity. Another distinguishing feature is the direction of the sacrum. In males, the sacrum tilts inward, again, creating a smaller pelvic cavity. In females, is pushed outward, creating a bigger pelvic cavity. Okay. So when it comes to the lower limbs, you know that the thigh bone is the femur, the leg bones are the tibial and the fibula, and then we have the foot bones, which are 7 tarsal bones, 5 metatarsals, and 14 phalanges and toes. Okay. So, and now we'll move on to the lower limbs. And the bones of the lower limbs are going to be the thigh bone, which is the femur, leg bone, which is the tibial, and then the lateral leg bone, which is the fibula. So here's the huge humerus. And so the humerus will be the thigh bone. These are the leg bones, the tibia and the fibula. The fibula is going to be lateral versus the tibia, which is going to be towards medial, center medial. Okay, the foot has 7 tarsal bones. Remember, the hands had 8 carpal bones. The foot has 7 tarsal bones. You don't have to know the 7 for the lecture, you have to know them for lab. But out of the 7, the calcaneus is the heel bone, and the talus is the ankle bone. So talus is ankle, calcaneus is heel. And then we have the actual tarsal bones right there. And from the tarsal bones, these little elongated bones, which are going to be the phalanges, just same way as the phalanges of the hand. They are labeled 1, 2, 3, 4, 5 in the direction from the big toe. Okay, so that takes care of the second set of PowerPoints. So this did not take very long. This is a very short chapter. There may be about no more than 15 questions on these material in the lecture test. So be prepared to answer some questions, but obviously the bulk of the test will be chapters 5 and chapter 6. Okay, so I'm going to sign off now, and I will post the recording as soon as it becomes available.